Looking out to the next decade and beyond, the healthcare environment will demand agility, creativity, and flexibility. So let's talk about the ecosystem of innovation. What does that look like for healthcare?
You know, in healthcare, it's a really broad set of activities in the ecosystem. Everything from wellness care to at-home care to diagnostics to acute care and therapy, the kinds of things we do, to pharmaceuticals to rehabilitation. At Intuitive, we live in the space of acute care. Let's talk about what's happened the last couple of years. I think there was a trend for minimally invasive interventions, the idea that you want to identify something early, you want to diagnose it very precisely, and then you want to have a low impact intervention for that patient to get them back to their lives quickly. I'll just give you a specific example. The 5-year survival rate for something like lung cancer is about 15%. So there's clearly a serious issue here. There are a lot of folks, whether it's prior smokers or people who have been exposed to environmental pathogens or a family history and background, that have suspicious lesions in their lung. They're found on CT scans. And today's standard of care is to look at those lesions, to wait 3 months, kind of check in and follow up and see if those lesions are growing. And yet here we have this 15% 5-year survival rate. So Intuitive has created a product on our side that allows a physician, a pulmonologist or a thoracic surgeon to navigate through the mouth into the lung without any cuts, to sample tissue at the distal parts of the lung, to be able to take that out and hand it to the pathologist and ask of the pathologist, what is that? And if it's cancer, you can move forward, you can move quickly to make a treatment decision.
And obviously technology playing a big part in all of this, helping make care less disruptive to the patient.
Yeah, I think just zooming out, the opportunity for diagnosis is really important and really big. Our colleagues in the imaging space are developing technologies that can see more deeply into the body with higher precision. And then companies like ours are trying to use some of those technologies to also sample tissues with really high accuracy. All of that is trying to drive toward this idea of we want to find something early and then turn around and provide that information to the healthcare physicians.
What about the advances with AI? Have they played a role in the detection and treatment of diseases?
Yeah, we're, I think, really at the beginning of the opportunity for AI, machine learning, machine vision to make a bigger impact in healthcare. There are some places that it's coming to routine clinical use today, really just the beginnings, whether it's looking, for example, at polyp detection during a colonoscopy or looking at suggesting to radiologists what images of a lung might be something they should look at twice. You're seeing the beginnings of that, and Intuitive is doing some of that work. None of these things work well in silos. Innovation is often best done when we're mixing expertise from different locations. It is that boundary, that interface, a little bit of the friction between two different sets of expertise and knowledge that also give us a great opportunity. And I think it's got to be oriented on the jobs to be done. It's got to be oriented on great patient outcomes, a great patient experience. The care teams in the space we work in, it's not automation and it's not delivery of a pill. There are human beings who have to deliver this care. We have to make sure that their environment is right, that they appreciate and can work through the things that we innovate for them.